thousands of girls in South Africa, some as young as 10,
Yeah.
becoming pregnant every year. It's, well, it's a heavy statistic, and that's exactly why we're doing this deep dive today. We're using these news articles to, really try to understand this whole issue.
Yeah, it's easy to get lost in the numbers, but we can't forget that these are real lives. Young girls facing a situation that most of us, well, we can't even imagine it.
It's hard to wrap your head around, right? We're talking like primary school children facing motherhood.
Huh.
One article cited these parliamentary findings,
Mm-hmm.
and it said over 1,400 pregnancies just in grades 3 through 7 between, let me see, 2014 and 2016. And that's just, what's reported.
And think about this, that's probably just the tip of the iceberg, right? When you consider the provinces where we just don't have the data, it gets even more concerning. But, what I find interesting is that South Africa's overall teen pregnancy rates, they're actually not that different from other African countries.
Oh, really? So what makes this situation stand out?
Well, it's the maternal death rate among these young mothers. It's shockingly high, even higher than in some other African nations, which, that raises a huge red flag. It makes you wonder what's going on beneath the surface.
Exactly. What's behind this tragic statistic? Because it's clearly not just about teen pregnancy itself, right? It seems like there's something else, something systemic that makes it so deadly.
You're hitting on a crucial point. One article I read said almost 20% of all maternal deaths in South Africa, they're teenagers. And this is despite them representing a smaller percentage of mothers overall.
Well, that puts it in perspective.
It does, doesn't it? And it really highlights the biological vulnerability we're talking about. Young girls' bodies, they're just not fully developed, which makes them so much more susceptible to complications, especially during pregnancy and childbirth. And when you combine that with sometimes inadequate healthcare systems, particularly in rural areas, it creates a perfect storm.
So we're talking biological vulnerability, limited access to proper medical care. It's like a double whammy.
It is, and it highlights how this goes way beyond individual choices. It's about a system that's failing to provide these young women with the care they so desperately need.
And failing on multiple levels, it seems. One article went into detail about how many of these deaths are preventable. They were talking about untreated high blood pressure, delays in getting these moms to hospitals that can handle the complications.
Which is heartbreaking because a quarter of these deaths, treatable high blood pressure, something that with proper prenatal care could be managed. And another quarter, due to these failures in referring them to the right medical facilities, they're just not getting the specialized care they need when they need it. And that points to a much larger issue of healthcare access, particularly for these young mothers who are already in such vulnerable situations.
Yeah, you start to see the patterns, right? It's easy to get stuck on the numbers, but then you read about the social and emotional pressures these girls are dealing with. One article talked about stigma and shame, how that prevents them from even asking for help, which obviously leads to late or no prenatal care at all. Can you imagine being so terrified to tell someone what's going on that you suffer in silence? It's heartbreaking.
It really is. You're talking about girls, some barely even teenagers yet, facing this incredibly difficult situation, and they're dealing with so much fear and judgment. And often that fear, it's completely justified. They risk being ostracized by their families, their communities, even their religious institutions.
And when you think about it, like adding those fears on top of an already impossible situation, I mean, it's no wonder these girls are hesitant to reach out.
Yeah.
It makes you realize this isn't just a healthcare crisis. It's like a fundamental human rights issue we're talking about.
Exactly. It really is. And the thing is, the consequences, they don't stop at the immediate health risks, right? Imagine being a young girl, your education's disrupted, your future opportunities, your economic independence, it all becomes so uncertain.
It's like it traps them in this cycle of poverty that's just so hard to break free from.
Exactly. And it's not just their futures at stake either, is it? The articles also talked about how these circumstances, how tough they can be on the children born into these situations.
Right. It's like a ripple effect. It impacts generations.
It does. And those children, they often face, poverty, lack of access to early childhood development resources. They're statistically more likely to face challenges as they grow up. It's a really tough cycle to break.
It's a lot to wrap your head around. These articles, they don't sugarcoat anything. But I think it's important, for our listener to remember that these problems, they're not insurmountable. We can solve this.
We absolutely can. And one of the most important things we can do is what we're doing right now, talking about it, shining a light on these systemic failures. And you know what else? supporting those organizations, the ones working directly on the ground to make a difference. They're out there providing sex education, offering essential healthcare services, empowering these young women to take control of their lives.
See, that's what I find so hopeful. Doing these deep dives, it's not just about, uncovering the problem. It's about figuring out how we can be a part of the solution.
Right, knowledge is power. And understanding the full picture here, the statistics, the systemic stuff, the human stories behind it all, that's the first step to making a real difference.
So where do we go from here? Like, for our listener, if they're listening to this and they're like, okay, this is heavy, but I want to help, what can they do?
That's the question, isn't it? Supporting those organizations, the ones working directly with these young women, that's key. Even a small donation, it really can make a tangible difference. But, it's not just about the money. It's about raising awareness in your own circles, talking to people, challenging those stigmas, even advocating for policy changes. It all adds up.
Yeah, I know it can feel overwhelming sometimes, like you're just one person, right?
Yeah.
But even small actions, they create ripples. Every conversation, every time someone gains a little more awareness, it all contributes to shifting the tide. It's about changing how we think about it, right?
Hmm.
Moving away from all that judgment and shame and like moving toward, understanding and support.
Yeah, exactly. These young women, they need compassion, not condemnation. They don't need isolation and stigma. They need resources, opportunities.
And honestly, this isn't just a South Africa thing, is it? Reading these articles, it got me thinking these issues, they're everywhere, right? I mean, anywhere you have these systemic inequalities, problems with access to education, healthcare, these societal stigmas.
Yeah. You're right. It's a global thing. This deep dive, it's just a small glimpse into this much larger global challenge. It reminds us that when we don't address the root causes, the vulnerable populations, especially young girls, they suffer the most.
This conversation has been, well, it's been eye-opening, that's for sure. We really went beyond the headlines, beyond just the numbers, to really try to understand what's at stake here, the human cost of all of this.
And my hope is that understanding leads to action. You've listened today, you've armed yourself with knowledge, and that's always the first step.
So for everyone listening, here's something to think about. We talked about the lack of sex education, right? And how important that is, how big of a role that plays. But what if we thought even bigger? Like, what would it take to create these really effective programs? Ones that not only empower young people to make, smart choices, but actually get at those root causes we're talking about, the gender inequality, the poverty. It's a complicated issue, no easy answers, but it's a conversation we need to have.